Well, that wave first spotted on the horizon weeks ago now appears to be coming ashore. Dr. Theresa Tam, the country's top public health doctor, is now warning the variants are pushing up hospitalizations and spreading among younger Canadians and making them sicker. Trends that have some communities preparing to be hit hard, and at least one province moving to tighten up its pandemic restrictions again. We begin this morning with Michael Serapio. Good morning, Mike.
Good morning, Heather. And you're right, this is exactly what we were warned about weeks ago, that by the end of March, variants would become the dominant concern. And that is exactly what we're seeing. The declines in new cases that were observed since the end of January now going the other way as case numbers inch upwards, once again driven in large part by these rising numbers of new variants. Now take a listen to Dr. Theresa Tam as she speaks about variants in this country, including the strain first detected in the UK, as that is the most common variant being detected across our country.
Particularly the B117 variant, we know that it can take off fast. The highest rates or highest incidence is in the younger age groups. As soon as you get more numbers of people, you're going to see more cases of severe outcomes. So if these numbers increase in the younger population, I think we're going to see increases in hospitalizations and ICU visits.
Now, of course, officials have also detected strains first identified in South Africa and Brazil. But when it comes to these variants, Heather, they are being felt most acutely in Ontario, Alberta, British Columbia, and Quebec, but in other hotspots as well, in particular in the West, which is why even with vaccination rollouts happening now, there is a huge concern. The rollouts are still targeting older age groups. They are not rolling out as quickly as some would like, and they do not target the younger cohorts that are getting hit hard by these new variants. And these are the cohorts that are more likely to socialize and interact, especially as provinces loosen pandemic restrictions, something that infectious disease specialist Dr. Matthew Outen is concerned about.
This is nothing to take lightly. There have been lots of cases of people with no prior medical history who get COVID-19. They're in their 30s and their 40s, they're in the prime of life, and they wind up getting severely sick and sometimes needing hospitalization for several weeks and sometimes not making it. To me, this is almost more of a tragedy now than it was, say, 6 months ago when we couldn't prevent this disease. Now we can, if we can reduce transmission for long enough to get people to get the vaccines in their arms.
So interesting to hear Dr. Outen's perspective on all of this. So as we look at the variants going up in numbers, Michael, then how are provinces reacting to try to get this under control?
Well, let's begin in Ontario with that one, Heather, because variants there have already pushed the province into its third wave. And Ontario has announced new funding for a program to drive seniors and people with disabilities to vaccination sites. Ottawa as well is now also funding money to roll out extra funding for COVID-19 isolation sites, the focus being Ontario's hotspots in an effort to curb the spread of the disease in the province. Now, in Alberta, officials, as you know, are starting to plan for a potential third wave because of variants of concern. And earlier this week, Alberta did cancel its plans to move to step 3 of its reopening plans. Hospitals in the province right now looking at capacity and laying out contingency plans for a possible spike in cases. And in Saskatchewan, there are now greater restrictions for Regina and surrounding regions. This is because of the number of variant strains increasing in the capital city. And Manitoba is staying in the red zone despite having spent more than 4 months under those restrictions levels already. Heather, again, very much concerned about the rising number of variants, in particular the B117 first detected in the UK.
Thank you so much, Michael Serapio.